Welcome back, family, to another episode of Basic Pharmacy Knowledge. Well, we are still on our topic law and ethics in pharmacy practice. In part one, we learned about the Pharmacy Council of Ghana, its role, structure, and how it protects public health through pharmacy regulations. Today, in part two, we are going deeper to see how the council actually runs its work. We will talk about committees, departments, licensing processes, and the code of ethics that guides every pharmacist and pharmacy support staff in Ghana. So let's dive in. Committees of the Pharmacy Council. The Pharmacy Council doesn't work alone. To make sure every area of pharmacy is well regulated, it has created special committees, each focused on a unique aspect of the profession. Let's explore them one by one. Audit Committee. This team makes sure every peso is well spent. They review financial reports, ensure transparency, and check that all funds are used wisely and lawfully. Think of them as the council's financial watchdog. Registration Committee. This committee ensures that only qualified and competent people become part of the pharmacy profession, whether pharmacist, pharmacy technician or technologist, MCAs, or over-the-counter medicine sellers. No shortcuts here. Quality and professionalism comes first. Education Committee. They handle everything related to professional training and continuous education. Their goal is to make sure every pharmacy school and training institution always meet the highest standards. Finance and Administration Committee. This committee advises the council on money and management. They make sure resources are well planned, well used, and well tracked. Legal Committee. When it comes to law and ethics, this team steps in. They handle all legal issues and ensure the council operates within Ghana's laws, protecting both professionals and the public. Entity Tender Committee. They manage procurement and supply, ensuring fairness, transparency, and no favoritism in purchasing goods or services. Editorial Committee. This committee takes charge of all publications and communications. They make sure every piece of information from the council is accurate, professional, and valuable. Pharmaceutical Facilities Technical Committee. Before a pharmacy or over-the-counter medicine shop opens, this committee reviews the application. They check the premises and facilities and qualifications before giving the green light. Continuing Professional Development (CPD) Technical Committee. Pharmacy is a lifelong learning field. This committee ensures professionals stay updated through workshops, trainings, and refresher programs. Pharmacy Technicians Committee. They focus specifically on pharmacy technicians, making sure they grow, follow standards, and are fairly represented within the profession. Over-the-counter medicine sellers or OTCMS committee. Finally, the Over-the-Counter Medicine Sellers Committee monitors OTC shops to make sure they sell only approved Class C medicines and operate responsibly. Each of these committees play a vital role in keeping pharmacy practice in Ghana safe, ethical, and professional. Now, let's talk about the Department of Pharmacy Council. The council is led by the registrar, who acts as the chief executive officer, as the CEO, working with two deputy registrars, one for professional development and the other for operations. They manage the day to day activities of the council. Let's see how their work is divided. Under the Deputy Registrar for Professional Development, there is the Training and Education Department. They handle professional training and education. There is registration and licensing department. They manage registration and renewal of pharmacists and pharmacies. There is administrative department. They keep office activity running smoothly. Now, under the Deputy Registrar for Operations, there is Legal Department. They ensures compliance with national laws. There is Monitoring and Evaluation Department. They checks the effectiveness of council's programs. There is MIS and Publications Department. They manage data, publications, and records. There is also the Regional and Zonal Coordination Department. It supervises the Council's regional offices across Ghana. Together, these departments ensure the Council's goals are achieved effectively and consistently nationwide. Licensing. Licensing is a key part of Pharmacy Council's work. It ensures that only qualified individuals and approved entities operate within the pharmaceutical sector. Let's look at the main types. Licensing for corporate bodies. A company or government body can be licensed to mix, prepare, or supply medicines, but only if they are fit to do so and are supervised by a superintendent pharmacist. If they break the rules, their license can be revoked. Licensing of over the counter medicine sellers. Over the counter medicine sellers play a big role in underserviced areas. They can sell Class C medicines, the safer ones that do not need a prescription, but not Class A or Class B drugs. Licenses are given based on the community's needs and can be revoked if rules are broken. License for wholesale supply of restricted medicines. Now, only licensed entities can distribute restricted medicines. They must follow strict conditions, and any violation can lead to suspension or cancellation of the license. Now, let's talk about Code of Ethics for Pharmacists. Every profession needs a moral compass, and for pharmacy, that's the Code of Ethics created by the Pharmaceutical Society of Ghana. It teaches pharmacists to sell only quality medicines. It teaches pharmacists to avoid misleading promotions. It also teaches pharmacists to never lend their names for unapproved sales. It teaches pharmacists to collaborate with other healthcare workers, and also it teaches pharmacists to always put patient welfare first. Simply put, a pharmacist must serve with integrity, dignity, and humanity. Now, for over the counter medicine sellers standards. Over the counter medicine sellers are vital in Ghana's healthcare chain, especially in rural areas, but they must follow clear rules. Sell only Class C medicines, no injections or prescription drugs, operate only in approved locations. Their licenses are not transferable and location specific, meaning where it was given, that is where you can operate. And before they are approved, they must prove their identity, training, and good conduct. All these ensure that medicine sellers serve their communities safely and legally. And that wraps up part 2 of our topic, Law and Ethics in Pharmacy Practice, which is under the Basic Pharmacy Knowledge series. Today we explored how the Pharmacy Council operates through its committees, departments, licensing processes, and code of ethics, all designed to keep Ghana's pharmaceutical sector safe, professional, and accountable. But we are not done yet. In part 3, we will take things a step further as we will uncover additional laws and ethical dimensions in pharmacy practice, including an in depth outlook at controlled substance and the Narcotic Control Commission Act 2020, Act 1019. You don't want to miss that. It is a vital part of understanding how Ghana controls and monitors drugs with high abuse potential. If you found today's lesson helpful, please like, subscribe, and turn on the notification bell to stay updated. And also share this video to help others learn about pharmacy law and ethics too. Up until next time, remember, pharmacy is not just about medicines, it's about discipline, trust, and service to humanity. This is Mariana from Mariglobe Health, that is Health and Med Knowledge. Until next time, if God permits, bye for now.